Welcome, everyone. Thank you again for joining us. I'm delighted to be talking about connection over correction. We put this one last, and I always kind of struggle because I think it should be first. People have the most questions about ketosis, and certainly we see that keto is extremely beneficial for so many people, and yet connection, it's really what life is all about. When I ask my patients who are in their 80s and 90s what was most meaningful about life, it's always their loved ones. It's their children, their siblings, their parents, their spouse, their loved ones that were the most important thing, and those moments with them. And so I really think that this is the most crucial of all of the conversations because it's about maintaining and building that connection, even in these stages of dementia and cognitive decline. And we've had these incredible coaching courses where I've gotten so much feedback. When we first started them, I was sort of pushed into doing it by a friend of mine who's more in marketing and sales than in healthcare. And he said, you got to do a course, you got to do a course. And I was like, I don't know how much value it would bring. And yet we've wrapped up another round of them. We've helped more than 200 people through them, Tyler and I, and Tyler is here with me tonight. And we just get this incredible feedback about what we're doing and how much value it brings. From Juliana, she said, showing love to who you are taking care of is so important. I was so stressed about making my dad follow every step of the Bredesen protocol. But when I started showing him affection and love, I noticed a difference that I'm less stressed and feeling more at peace. And so is he. Most importantly, right? Is like, what is our experience of this process? I wouldn't wish it on anyone. And yet so many caregivers look back and they're so grateful for the experience of being there with their parent or their spouse. Growing old in whatever state is a privilege that's denied to so many of us. And if we can, the whole goal of Dr. Bredesen's approach of everything that I do is to reduce the suffering associated with dementia and Alzheimer's. It's to amplify the joy. It's to amplify all the connection and the good stuff with our loved ones. And so that takes work. It requires work and it requires effort, and it can feel overwhelming. Catherine said to us, I want to say that being in this caregiver support program is especially helpful as we're all on the same page about implementing this program in hopes of making things better rather than just supporting a loved one down the difficult road to demise. There's so much hope and purpose in it. And this position of caregiver requires such an enormous amount of love. Being a caregiver has changed the relationship for me with my husband because we're no longer partners or peers. It has changed the husband-wife relationship, and it's a different kind of love that I've learned so much about through this course. These are just a couple of the things that we've heard. And so I just want to encourage you, if you're considering the course, please join us. Don't wait. We're going to get started next week. And we also have I don't have a celebrity guest tonight, but I've got one coming for you next week. So stay tuned, check your emails. We're going to be sharing more about that soon. But let's dive into connection over correction and what that means. Right? What does that mean as we support someone with dementia? And first, let's take that moment to step back. Where does that fit into the big, broad spectrum of everything that we're trying to do? So foundations for brain health, it's that diet, it's the activities, it's the brain engagement, it's the movement, it's sleep, it is routines, it is the medicine, the medical treatment, potentially fighting infections or reducing toxicity or doing hormone replacement. It's the environment that we create that allows our loved one to shine. And so all of these pieces are part of everything that we've discussed in these 4 weeks of webinars is to give you a taste of all of the rest. And I really wanted to start with kind of the biggest, most impactful pieces, hopefully give you some great takeaways that improve your life and the quality of your life right away that you can get started with and If you feel overwhelmed, there is so much support. We are here for you. And we want to make sure that you're getting the most possible benefit from Dr. Brunison's approach. From Amy, she said, I've been less irritated since taking this course. Our days are so much more pleasant. And my mom is also getting better, most importantly. Well, I don't know. It's all so important, right? It all belongs. She's more alert and remembering conversations with loved ones. And there's that connection, right? When someone remembers the conversation you had, when they are alert and present, not just glazed over and absent, we get that connection, that sense of connection. And it goes in both directions. And it allows us to feel so much less irritation, less stress. So when we are goals for a typical day, meaningful connection has been one of these things that we've talked about in all of these every week, right? Meaningful connection over a ketogenic meal, meaningful connection while playing a game, meaningful connection while getting some exercise. And in everything we do day to day, there's this opportunity, whether it's helping someone go to the bathroom or get dressed, or if it's having a conversation over FaceTime or playing chess, whatever it is, this time for connection. We are social creatures, and isolation, social isolation, that feeling of loneliness is toxic. It is dangerous. It's as dangerous as smoking cigarettes. So we see this show up again and again in the medical literature that we require connection. And when we're under stress, which often we get from a feeling of loneliness, from disconnection, we don't learn, we don't remember. Many of us can relate to stage fright, being in front of an audience and forgetting everything that we are going to say. Now, when we have that day-to-day stress of feeling like we're disappointing someone, of feeling like we can't measure up because we can't remember, then we are under stress. And so reducing the stress at any opportunity with your loved one, and also remembering to do this for yourself, you can increase the joy. And in increasing the joy, you increase the capacity. I have to do a housekeeping thing really quick because I did not make Tyler a host here, and I need to make her a host so that she can make sure that she's responding to all of your questions. And because I want her to put in the chat right now, there's this wonderful article that we refer to in the book. And it's about why it's so important to have fun and how we learn better when we are having fun. And I want to share it with everyone because it is such a great read. And it's the kind of thing that we discuss in our meetings when we connect with each other every week in the coaching program. Okay, you're promoted to panelist, Tyler. Welcome. And hopefully that worked. So increasing the joy is how we increase that ability to remember, to engage. All of this is of course, the goal is for people to remember and to improve their cognitive capacity. And in doing that, it needs to be fun. It doesn't, I guess it doesn't have to be. I guess there are people who have probably made it really not fun and still gotten better. However, it's easier. It's actually part of the prescription is to have fun, to spend time connecting. And I want to give you some guidance. And although I'm not the best one to do this, I'm going to introduce you to some people who are. Connection, there's this opportunity, and I did this last week, but Teepa Snow, her positive approach to care, she has this incredible YouTube channel. She has some books, but I would recommend, she is best to consume and really inspiring by video. She's funny, she's super engaging, her videos are so well done. And so I would highly recommend, it's a very rare that I suggest that someone go down the YouTube rabbit hole. But if you're going to do it to learn from Teepa Snow, I'm a thumbs up, 2 thumbs up, go for it. She is so informative. And I'm a parent to a 5-year-old. I have a partner. And, when we are communicating with each other, there are things that I remember that Teepa said that are helpful. So this isn't just about discussing something with someone who you love who has dementia. Some of the things that she describes, like figuring out people's unmet physical needs and unmet emotional needs, and being curious about that. If someone has to pee, whether they have dementia or not, they're kind of irritable, right? They've got to get to the bathroom and they're in a rush and they can't hear you because they have an unmet physical need, a full bladder. And just, I mean, that little shift in that perspective of like, oh, I'm curious about that. Like you're hungry or hangry. You're not going to be, that person isn't going to be able to be present with you. So how can we help meet their unmet physical needs, or identify and help meet their emotional needs, like potentially loneliness, that feeling of disconnection with which often comes up when there's confusion or miscommunication, or even when we are feeling short or irritable or rushed. So Teepa has a really phenomenal and very deep library of information. She's also a phenomenal resource to just reach out to and talk to if you're facing a difficult situation. We reach out to her regularly at Marama, and all of our staff at Marama go through her online training. And so we're just so grateful to have her as a resource. And she just does a phenomenal job. I can't recommend that enough. Now, there are a number of books, but this one by Joanne Koenig Coste, I really love. It's called Learning to Speak Alzheimer's. And she, unfortunately, her husband was diagnosed with early onset Alzheimer's when she still had a baby in diapers. And they had, I don't remember if it's 3 or 4 kids, but she had a baby in diapers, and then a husband, a partner who was developing Alzheimer's very quickly. And when she got through that crisis after her husband passed, she really reinformed this whole idea of connection over correction. So she has this great story in the book where there's a woman in a nursing home who tells the staff that she has had breakfast with her mom. Now, this woman is in her 80s. Her mom has passed away decades before. And the staff typically would say, no, your mom passed away in 1975. But instead, what she recommended was that connection over correction, to say, what'd you have for breakfast with your mom? Was it your favorite omelet? Was it your favorite pan? Did she make waffles or pancakes? Like, what was her favorite thing to make? What did it smell like? What spices did she use? To really engage with them in the story, in their reality, and that allows them to feel seen, feel heard, and it reduces and diffuses the stress. Now, I have to be completely honest with everyone, is that on Friday, I was at Marama and I did a terrible job of this. So I went over there for a dinner, and I mean, I teach this, this comes up quarterly in all of our coaching courses. I talk about this with staff. I talk about this all the time, and I get it wrong. And so this is something where we all need to give ourselves a little bit of grace. And I was at dinner, and one of the community members, one of the residents who lives at Marama, she didn't recognize who I was. There was another person there with me who I'm looking to collaborate with in work. He was there and checking out Marama, and I wanted him to be impressed, right? So when this woman, the resident with dementia, didn't recognize me, I in retrospect, I'm like, was it my pride that she didn't know who I was? But she clearly didn't know who I was, and I kept making comments to kind of try to remind her, to basically try to correct her. And she didn't know who I was. And he even said, "This is Dr. Sandison." He introduced me to her, and I still kept doing it. So this is challenging. This is hard. I think part of me was not remembering that she had remembered me. I had been there a few days before, and she had remembered me then. And so I was a little confused, but I know this space. I work in this space every day, and I should have quickly been able to say, "Hi, I'm Dr. Sandison. Tell me about," and have her tell me about herself. And instead, I kept saying, "Oh, you make the best flower arrangements. I've seen them," and trying to convince her that she knew me, which it was about me, not about her. And so that's part of the invitation, is to, how do we get curious about this person that we're interacting with so that they have their physical and emotional needs met? They feel seen, they feel heard. Whatever situation that might be sort of stressful is diffused. I was very lucky that this woman was not particularly offended or irritated by what I was doing. It didn't have horrible repercussions. I'm sure my colleague, who I'm hoping to collaborate with, wasn't overly impressed with my performance, but oh well. Hopefully there's some grace. This is challenging. This is hard. And thank goodness we get a do-over. I'll be over there next week and I'll get a do-over. And if she says, "Who are you?" and she starts to introduce herself, I say, "Hi, I'm Dr. Heather Sandison. I'm so glad you're here. Like, how are you doing?" And try to find other ways to connect with her, not assuming or pushing my agenda that she know who I am, right? So I'm hoping I share that story because I hope that everyone can kind of see themselves in it a little bit. Where do we do this? And how can I start to be first aware of it? So here are some ideas about how to think through this. And sorry, I'm talking and there's all these words in front of you. So take out your camera if you want. There's going to be replays and you'll have access to this again. But feel free to take out your camera because it might be nice to just have this in your back pocket, literally like in your phone, and be reminded if you start to feel kind of the way I did, like prideful or like you have an agenda and you need to correct. Instead of arguing, try agreeing. Instead of reasoning, try diverting. Instead of shaming, try distracting. Instead of lecturing, try reassuring. Instead of saying, "Remember," try reminiscing. Instead of saying, "I told you," just repeat it. Instead of saying, "You can't," try stating and then focusing on what they can do. Instead of demanding, try asking. Instead of condescending, try encouraging. Instead of forcing, try reinforcing. So I hope that each of you, and if anyone's open to it, please share in the chat if you've had an experience like this. And the invitation is to go back and kind of think through it the way I did with the resident at Marama. I'm imagining that this is going to happen again. This is going to come up again. And how do I want to behave? Who do I want to be in that so that she feels more connection? That's the goal. I want to remind everyone about Kirtan Kriya, because this is a big part of, so Kirtan Kriya is the Sata Nama. If you weren't here the last couple of weeks, I bring this up regularly because there's such great data on meditation and particularly Kirtan Kriya for dementia and for caregivers as well. So part of the meditation, I've been meditating for decades now and off and on, and always benefit even more when I'm on. But the goal, the way I see it, is, and there's not supposed to be a goal, so forgive me for that, but the reason that I meditate and the benefit that I get from it is I get this gap, I get this opportunity between the trigger and my response. I get this opening of awareness of, oh, I'm triggered. Oh, I'm angry. Oh, I'm irritable. Oh, I'm hungry. And it gives me an opportunity to make a different decision about how I want to respond. And that is something that helps us to do this, right? To execute on this connection over correction. That if we can have that space, if we can have that opportunity to choose a different path, then now we can take it, right? If that trigger and response are so close to each other that it's just regret that we're having, then we don't get that opportunity, right? We don't get that space. So meditation, whatever form it takes for you, mindfulness, Bible study, prayer practice, gratitude journaling, whatever mindfulness practice it manifests for you, whatever you can create in your world, I encourage you highly to do it, to take advantage of that. And many people will feel like, Satanama, what am I doing? I'm not doing it right. I didn't get anything out of it. And yet I suspect most people, what they notice is that 3 or 6 months later, once you've had a regular practice, there's this profound shift in that space between the trigger and the response. And you notice you're not as reactive and you're even probably less triggered. more creative, more insightful. In fact, Liz had told us that after being in the group with us, she was experiencing that I've been able to solve problems more creatively and calmly since joining the group. And I know she had also, I remember she had started meditation, but it was all of it, right? It's the diet that helps us to feel more stable in terms of our mood. It's potentially some meditation. It's this understanding that if we look if we go in the direction of correction, we're going to create disconnection, which is going to increase the stress, which is going to make it harder to learn, harder to remember. If we can go in the direction of connection, we're going to reduce the stress. We're going to make it easier. We're going to make it more joyful for everyone involved. So my hope is that many of you, since I've been talking about it, have already adopted some kind of mindfulness practice. Here's another one where you're welcome to take a quick picture. These are connection over correction, I'm sorry phrases. So this is a sincere I'm sorry, looking in someone's eyes, maybe even grabbing both hands and saying, I'm sorry, taking accountability, and can diffuse so many situations. So I'm sorry I was trying to help. I'm sorry I made you angry. I'm sorry I embarrassed you. I'm sorry I treated you like a child. I'm sorry, I know this is hard. Maybe even I'm sorry, I know you're doing the best you can. Those types of phrases, when said with sincerity, any human being, regardless of how far along the progression of the disease state they are, they're going to pick up on your intention, your tone, and your sincerity. They'll pick up on your energy. And if you can sincerely say, I'm sorry, that will diffuse many situations. And you're welcome to add to the chat if you've maybe experienced that. Or if you can imagine a situation where if you had apologized in real time, potentially, that you would have had the opportunity to diffuse that situation. Many people describe these like day-to-day activities, right? Of trying to get in the car. And especially when we're doing this Bredesen approach, there's a lot to do. You've got to get to the doctor's appointments, and you've got to get to the gym, and you've got to get to the music class and to church and all of these things. And you want to get there on time so that you can get it all done, so that you can get home and you can make the food. There's a lot to do. And so it's like repeating yourself, put on your shoes, get in the car, particularly when it's your partner or your parent, where you didn't have to do that before. There's this level of like grief often every time that comes up that can make us sad, irritable, angry, upset. All of these emotions come up. Like, I'm working so hard, I'm trying so hard, and I just want her to put on her shoes and get in the damn car so we can go. And noticing when that's happening, maybe even acknowledging the grief that comes up. This is why Alzheimer's is often called the slow goodbye, right? Is this we're constantly reminded that we're losing this person, or that we've lost some piece of this person that we love. And so acknowledging that, honoring that, and then saying, okay, now that I'm aware, what choice do I want to make? And for most of us, if you're here, it's to connect, it's to diffuse, it's to create more joy. And so that's the point. That is why we're here. So I want to take you through the coaching program one more time and share what that looks like. And then I'm going to jump into the Q&A. Please add your questions to the Q&A. There's only one in there, so we're going to get to lots of them tonight. So please, please, please add to the Q&A. The book will be out June 11th. When you purchase the course, you get a copy of the book, and you instantly get a copy of the workbook, which is a PDF that'll come to you. And you'll also get summary videos of the entire book right away when you join the course. So you also will get these Reversing Alzheimer's we say 60 minutes, but they end up being 90 minutes because we get to all of the questions. Many of these weeks when we have hundreds of people joining us, there's so many questions, there's no way I could get to all of them. So in these groups, we start with questions. We start there, we make sure that your questions are answered, and then we get the benefit of having everybody involved in the conversation. So sometimes I'm not the one with the great answer, it's somebody else who's in a similar experience, who's already been through what you're going through. And then of course you get the book, you get the video summaries, you get the workbook. We are also getting you access to a separate 11 module caregiver training course. And so you'll get access to that instantly as well, and access to the private Facebook group. And you can stay in that Facebook group forever. You get access to all of the stuff forever. This is not like we cut you off after 12 weeks. You are in the community forever. We're so grateful. And as you sort of go through the process, you actually add a ton of value to the people who are joining later. And so we really appreciate that. You will get a one-on-one kickoff call with the amazing Tyler, who will help and support you along the way. There's also an option to upgrade to get more one-on-one calls with her. Each family has unique constraints, issues that come up. You've got strengths as well as constraints, right? Some people have I was talking to a gentleman's siblings. He has 3 siblings last Friday. We were talking about him moving into Clear Mind Center in Kansas, and these 3 siblings show up and they are well educated. They are totally behind him. They are so supportive, and they are just like, he's only 63. And so they were like, we want to do it all. We want to help and support him. Their mom has been through dementia and he's so young. They don't want that happening for him. Siblings, I swear, they take the best care of each other. I'm going to put my brother as my power of attorney because there's fewer dynamics, I think. What we see is that the people who show up with their siblings, spouses and adult children, do an incredible job. To all you spouses and adult children, thank you for being here. And there's something about that sibling dynamic that is really, really, really sweet. And so you get to join this priceless community where we understand your unique situation, and we also get the benefit of all coming together. And again, I don't have all the answers. We're at the very beginning of this movement, and I've only been doing this since 2017. We don't know what's possible. We don't know what's on the horizon. We don't know, every time I am learning so much from the people who join us, who show up. And Kathy was telling us, I was so overwhelmed with all the new knowledge from Dr. Bredesen, and your class has helped us get on track. My dad ended up going to a biological dentist after you mentioned it, and it saved his life. Thanks to your recommendation. I don't know what we would have done without this class. Leslie also commented that the books are so dense and the course breaks it down into bite-sized pieces so that I can start the parts as I'm able and with more specifics for my husband and I. I also love hearing other people's experiences. So there's just so much to the community that I want to give everyone access to. So you're getting the course, coaching with me, the book, the workbook, the private Facebook group, plus the coaching call with Tyler. And right now, we are doing this because you are here. So we're going to actually cut this out. But because you guys are here right now, we are dropping the price back to $19.97. We had increased it to $24.97, and our classes are not quite full yet. So this will close, but we have a few more spots left, and we want everyone to get the benefit if they are looking to. So please join. My schedule is overwhelming at the moment because of book launch, and I'm not sure if we're going to have another one in the fall. So this may be the last one this year. So if you're interested, don't wait. Please join us starting next week. What it'll look like, you will log in here. You will get through your email. Once you go to Start Reversing Alzheimer's, you'll get a login. You'll be able to update your password. And then once you're logged in, it'll look like this. You can start the course. You can get access to all of those materials once you're logged in there. And then we have coaching on Zoom every 12 weeks. So Thank you, thank you, thank you for your questions. I see them, and we would love to have you join us in the coaching, but let's get to these questions here tonight. Will a link to this presentation be mailed to the attendees? I was late arriving. Mary Ann, there is going to be a email going out because you signed up. There will be an email with the replay going out, and you will have access to that. Yes. Will sauerkraut be an okay substitute for kimchi? Lee, it depends on what you're trying to do with it. So sauerkraut is a phenomenal way to get good, healthy, wonderful fermented foods. And so if you're trying to repopulate your gut, yes. Now we also use kimchi and we use kimchi juice in the sinuses because kimchi has a particular bacteria that's really phenomenal for repopulating good flora in your sinuses. And so you wouldn't use sauerkraut instead of kimchi for your sinuses, but you certainly could use it for your gut. If I buy the book from Amazon in the UK, will I still get the bonuses? Nigel, yes, you will. We are happy to get you those. Is there a red light lamp company that you recommend if I don't have room for an infrared sauna to use for healing? Yes, absolutely. We love, did I get those? Sorry, I'm trying to keep better track of these questions. So, Adise, I hope I'm saying your name correctly. That's beautiful. We love the V-Light. So the V-Light is a helmet that it has red lights, and then it has also a nose clip so that you're getting red light through the cribriform plate. Now, you can use the Juve light. So there's a few different types, but the V-Light Neuro Duo is my favorite because it has both alpha and gamma settings, and many people, both caregivers and people suffering with dementia, suffer with anxiety. And so the alpha setting helps with anxiety. And we see this with caregivers, our staff at Marama and Clear Mind Center. They can wear that V-Light helmet for 20 minutes and feel much less anxiety. They feel much calmer. And then same with our residents, we see them calm down after 20 minutes on alpha. Now, gamma is designed for memory. And so you can use the gamma setting for 20 minutes, 6 days a week or so, and that can be helpful. We've seen that it's been beneficial. Now, to be fair, we don't do any of these things in isolation. So I've never tested the red light therapy in isolation and only doing that. But certainly there's a gentleman named Michael Hamblin, who was at Harvard for a long time, and he published prolifically in the literature, the peer-reviewed literature, about the use of red light therapy for cognition, but also just for mitochondrial function generally. So the Juve light is for the full body typically, or part of the body, and depending on the size you get. And we have seen that people who skin their knee or have some sort of injury, when they put it in front of the red light, it heals much faster. So I hope that's a good answer and helps with your shopping for a good red light. From Leah, how do you approach a family member that has severe memory and cognitive changes to get them to agree to go to the doctor and get help? Leah, this is such a challenging conversation. What happens is that, I love these coaching courses because we create this it's such a privilege. We get these really safe containers where everyone gets to have these conversations in real time and share their experience, and we learn so much from them. What I've learned is that there's no one right answer for any family, and it's dynamic. It changes. Your loved one may get better. They may not. They may get worse. They may be in a steady state for a really long time. That's really challenging. And they may be combative and argumentative one day, and then they might be blissfully kind of happy as their disease progresses or changes. And so these conversations about going to the doctor or getting them to agree, I don't want you to become a martyr to that. And so do your best, use connection over correction. I recommend we have a conversation guide, and we suggest make sure there's no distractions. There aren't noises in the room. Make sure that they feel comfortable. Do everything that you can to kind of prioritize that conversation, and be fully present yourself. Make sure your phone isn't going off, or there's not a dog that needs you, or the things aren't buzzing, or you don't have to get up and get the tea kettle, right? And really give them your full attention. Whenever someone, me, right? Anyone, whenever we need to refocus, there's a mental lift that comes with that. And so I recommend really making sure that there's the lowest mental lift for whoever you're having this hard conversation with. Because sometimes it's about going to the doctor. Later, it might be about moving into memory care or assisted living. And so when we have these conversations, we want to make sure that they, like Teepa Snow says, that we've shined them like the gem that they are, right? We've put them in the setting, we put them in the environment where they can be their best self. So make sure they're fed and not hungry, that they've used the bathroom, they don't have a full bladder. And then the conversation, depending on the person, you may want to make it about healthy aging, about living well, not specifically about your memory decline, right? So the tone of voice, the words that we choose, if you know that someone's triggered by the word Alzheimer's, don't use it. Use something different. And hopefully, right, hope, like, so many people are afraid to go to the doctor because what they get is medications that don't work very well, their driver's license taken away, and hopelessness. False hopelessness is what Dr. Bredesen and some of our colleagues call this. There is so much hope. And I think many people, from 10 years ago, we didn't have this new data. There weren't doctors like me that were having these experiences all the time. And so approaching that family member who's kind of stuck in that mode of there's nothing we can do, that it might be okay if that's their choice, that they don't want to do anything. And that's always going to be okay, right? Like, people have to make their choices. There's Katie, I think it's Engelhardt. She wrote a book called The Inevitable about the right to die movement, but she also writes these really fascinating articles about Alzheimer's and people who are in prison with Alzheimer's, and what to do if your loved one, as they age and go through the dementia process, if their decisions change, right? If when before they had cognitive decline, they wanted one thing, and then now they have dementia and they're very clear that they want something different. Which guidance do you follow? Which person is the real person? These are such challenging conversations and such challenging decisions to make. And there isn't a right answer. I think if you ever end up in a situation where you say, okay, I've done everything I can for my loved one, they are choosing this path, whether cognizant of it or not, but that's what's going to be best for them. And now I need to focus on me. How do I go get my cognoscopy? How do I optimize my exercise, my sleep, my diet? That's where sometimes the best decision is to refocus and make it about your health and how you are going to age, particularly if you're genetically related. Hi, Kathy from Kathy Bliss. We're really looking forward to having you in the coaching course. I had many teeth pulled by a biological dentist, and recently I was told to get a couple of implants, as I don't have any chewing surfaces. Have you seen 4/4s do okay with implants, titanium or zirconium? So great question. And since I know that you're in San Diego, I am a huge fan of Dr. Al Fala. And so I recommend asking him. He's really the expert in that. And I believe, at least because I have an implant from Dr. Fala, and what we did was test my compatibility with the metals. And I think that, if you start to have lots of teeth pulled, then there's less surgery, it's less expensive. So talking to him about what your options are is what I would do as the next step. I wish I knew everything that the biological dentist knew, but it's not my area of expertise, but it's a phenomenal question. Is the class from Pete created for the afflicted person or the caregiver? Yeah, for both, Pete. So we have couples join us. We have often. We also have people who are in the early stages of cognitive decline who have started to notice changes. We also have people who are caring for a loved one. We have people who are in the prevention stage who don't have any cognitive decline yet, but who are either 4-4 or have some reason to believe that they're at high risk, and so they want to learn about it early on. We have people who join us who are medical professionals, which I am always delighted, because that means that there's like a ripple effect going out further into the world, and that just makes me so happy. Um, so yeah, everyone learns from all of these perspectives. So we welcome everyone who cares about reversing dementia, reversing Alzheimer's. From mountain views, what is a biological dentist? So like, I'm a naturopath. My focus is on the brain but the body, and on health and how to prevent disease, how to optimize health. A biological dentist, of course, they're focused in the mouth, but they are typically whole health dentists. So whole body dentists, biological dentists, sometimes you'll hear both. But a biological dentist is thinking about your mouth as something that will interrelate with the rest of your body. They're not just thinking about, oh, this tooth, like I got to fix your sore tooth. They're thinking about how that relates to your brain and your heart health and your entire body. They also are looking to remove mercury amalgams in a very safe way. They call it the SMART method, to reduce exposure to mercury. They are not as big of fans of root canals, because root canals can harbor latent infections that can trigger inflammation in the brain and elsewhere. So a biological dentist basically is taking a slightly different perspective than a conventional dentist. Now, when it comes to seeing a biological dentist, you need to make sure that they're both a good dentist first and a biological dentist. So sometimes there are people who are not both, and dentists are not all created equal. Sharon is asking a very similar question: a biological dentist versus a whole blah, 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 blah. Excuse me, I'm getting so excited about this dentist conversation. A biological versus a holistic dentist, which is better? Sharon, it really depends on the dentist. Like, finding a dentist who does good work and who you trust is what I want most. And so, yeah, gosh, I wish I could just fly everyone to San Diego and have you all see Dr. Fala, because he is my favorite. He's the best. He costs a little bit more, but I will tell you, in the 10 years that I've been seeing patients in San Diego, I have never seen anyone who's seen Dr. Fala have to get anything redone. And let's just say, for all the other dentists in the neighborhood, I've seen expensive dental work need to be redone. He just is he's wonderful. So someone like him, his poor office, but you could reach out to him and ask him if he has a colleague in your city or state. Also from Kathy, I have low temperature, 94 to 97. Do you like Stop the Thyroid Madness, where they recommend Armor and then 12 hours later take T3? So yeah, great question. This is such a personal question for you to have with your doctor about how to manage your thyroid. I have had patients all over the board. Some just take T3, some take Armor, some take Synthroid plus Cytomel, some take one or the other without, some take it multiple times per day. I've had patients who take it right before bed, which is totally contrary to what everyone says, which is that you should take it right away in the morning. So I've seen thyroid delivered in many, many, many ways in terms of how to take it. And so I'm not attached to one way of doing it. The best way to do it is what works best for you. And I think that, again, like having a conversation with the doctor who's managing that is probably the best next step. From Carol, do you know if bioidentical hormone replacement therapy helps with cognition? So Carol, that has been my clinical experience, is that I have seen patients who get on bioidentical hormone replacement as part of a comprehensive strategy of diet and exercise and sleep and stress management and toxin reduction and all of the other things. But yes, my understanding of the literature is that those hormones, estrogen, progesterone, testosterone, pregnenolone, DHEA, but also vitamin D and thyroid and BDNF and many others, those signals go to the brain and promote the production of new neurons and new connections between them. With bioidentical hormone replacement, If you have a personal history of breast cancer or an estrogen and progesterone receptor positive cancer, then the risk benefit analysis is a very, very different. And so, but if you have a history, if you're here because you have a family history of Alzheimer's, or you have genetic risk, then having bioidentical hormone replacement on board is probably beneficial and helpful for your brain. Also osteoporosis, so it's good for your brain, your bones, and heart health. Reduces all-cause mortality in a study done in England, and then also reduces the risk of dying from breast cancer in a big epidemiological trial from Finland. So you can probably find research that supports both directions. In fact, I know that you can. But what I have seen clinically is that bioidentical hormone replacement generally supports and helps with cognition. From Mountain Views, do you have any recommendations for adult children caring for narcissistic parents with dementia? Are there different treatments for narcissistic parents with dementia? Caring for a parent who was never interested in who you are and now literally doesn't know who you are is kind of the opposite experience for the caregiver who's gradually losing a parent who used to know and love you. Yeah. Oh, I'm so sorry. I can only imagine. I've been thinking about attachment styles recently because my daughter is 5, and I, am interested in personal growth and all of these connection and relationships and how they impact us. And this is just, I feel for you. And I do not have any particular recommendations. My hope is that maybe it's a little bit easier because you didn't feel so attached, and you never had that love. I don't know, there's maybe a little slightly less grief, but I'm not sure there's also some grief around the potential feeling gone. I'm so sorry. That sounds really, really challenging. I've heard that craniosacral from True Rife PC. I've heard that craniosacral therapy is good for people with dementia. What do you think? So my personal experience is that craniosacral is one of the more profound things. I put it with meditation as being one of my, personally, my most profound medicines. So craniosacral, I recommend, if you can find them, a provider trained by a gentleman named James Jealous. He has since passed. He lived in Europe, but he trained a number of MD and DO providers. And people who were trained by James Jealous tend to have a level of expertise and get better outcomes typically. So there's a link and a website, but you can just look for James Jealous, like jealousy. James Jealous trained craniosacral providers. And if there's someone near you, there's a physician finder on the website, and there's providers in Europe as well as in the US. The gentleman here in San Diego, his name is Walter Cohen, and he is phenomenal. I have patients who come into me and say, it's been great seeing you, Heather, but the best thing that you ever did for me was refer me to Walter Cohen. And I hear that a lot. I hear that all the time. And I'm like, well, I'm glad I could help. And so I do, yeah, if you can find a good craniosacral provider, especially a James Jealous trained therapist, I think that that can be profoundly healing for the nervous system, for dementia. I wouldn't do it alone for dementia. I would do it in a comprehensive way. With diet and exercise and sleep, all of the things that we talk about all the time. But I think particularly for someone who's experiencing some sort of like emotional dysregulation or structural issues, you're not sure if they're getting enough blood flow, maybe their neck is out of alignment. There's a lot of times when that's very, very appropriate in a dementia case. And I think it would be very helpful. From Deb, what type of mercury testing do I recommend? And is it true that mercury poisoning in the brain cannot be detected? And what type of detox is if suspected mercury poisoning? Yeah, great question. So I use Quicksilver. So they have a test that's called the mercury tri-test. It looks at organic and or at methyl mercury and inorganic mercury and total mercury. And then I use the Quicksilver IMD product. with glutathione and methyl B12 and vitamin C. The way that Chris Shade, who owns, and he's a biochemistry wizard, he's certainly a genius, a super smart guy, and he developed a very safe way to get rid of mercury. So at this stage in my career, I do not recommend chelation. I don't use it. Most of my patients are postmenopausal women. I think that chelating, so using a biochemical binder that goes in and pulls out mercury, it gets absorbed into your blood. Usually you do it by IV, or you can do oral DMSA or DMPS for mercury specifically. Those chelating agents, they also bind minerals. And so you run the risk of putting your bones through demineralization. So I don't use those anymore. So I know some people have questions like, oh, should I use a chelating agent? And my answer is, if you are a postmenopausal woman or you're asking for a postmenopausal woman, no. I would just use the IMD powder because it works very well. It's much less expensive. Oh, I love that, Dell. Thank you, Dell, for responding around a narcissistic parent with, I can't talk tonight. A narcissistic parent with dementia. See, that's the community. This is the power of community. I don't know the answer, but there's somebody here who does, who has an experience share. Maybe not the answer, because there's often in these questions and these scenarios, there's not one right answer. However, there's someone else with an experience. There's someone else with an insight, and that is the value. Thank you, Del. You made my point for me. That is the value of this community. So thank you, thank you, thank you. From Mountain Views, what is a cognoscopy? So a cognoscopy is this fantastic term that Dr. Bredesen made up. He's so funny. He makes me laugh. And it's the idea is when you turn 50 or 45, you get a colonoscopy to check to see if you have some of the early stages of a colon cancer. And then you deal with it, right? You cut out the polyps and then they tell you when to come back. With a cognoscopy, what you're doing with a provider who's like me, trained by Dr. Bredesen or one of the other Bredesen trained providers, you're going through the comprehensive labs and you're going through the questionnaires that would tell us, are you at risk for developing dementia? Do you have, you're systematically going through toxicity, stressors, structure, nutrients, infections, signaling. What am I missing? What do I have too much of, too little of? Is it in the right place at the right time? That's the idea of a cognoscopy, is can we catch these causal level factors before they create amyloid plaques, tau proteins, those downstream effects that are associated with Alzheimer's, and of course, most importantly, cognitive decline. From Kelvin, do I recommend acupuncture for people with dementia? Yes, I'm a huge fan of acupuncture. I think it'd be very regulating for the nervous system. They also, like, whether it's traditional Chinese medicine or 5-element acupuncture, there's a few different types of acupuncture. But I have found personally that acupuncture, it's just an entirely different system of medicine. And so you get the benefit of that, right? And for me, acupuncture, I took a year of acupuncture when I was in naturopathic school. I didn't finish it, but I can still go to an acupuncturist and like, I don't really know what they're doing. And so I can check out, and I'm not, I'm as a provider, sometimes I'm thinking through like, what about this? And what about that? And with acupuncture, I just let them heal me. So nice. Oh, what do I do when my spouse is very, very angry when his license was taken away by the doctor? Oh, it's so hard. Um, this is so challenging. I mean, I don't know if you can help them get set up with Uber or Lyft, or if there's someone who can help with driving, or if you can offer to drive. It's this idea that their independence is gone, right? Dignity and independence is gone. And so getting at that unmet emotional need, what is it? What is it exactly that's happening here? Of course, it also may be the shock of the diagnosis, or having to reckon with the reality of how cognitively they've changed. And so maybe exploring that if they're open to it, like what is it that's so, I think under anger is usually grief, right? So can we get to that? And then is there a way to soften the blow by creating some alternatives? Or is there a way to really heal the wound? Like, what is the grief? Can I process that grief and get to the other side of it? Find a way to be happy regardless of the circumstances. So that's not always easy, right? Like it's very challenging. That's why meditate. Um, Easier said than done often. And I would love, please, whoever has any insights into that, anybody been there, where they've had a spouse or someone else that they love, a parent who's had their license taken away by the doctor, and how did you deal with it? What came up? Oh, from Pete, spelling the dentist name. I'm going to type the answer here. Dr. Alfala. From Beth Reeves, I'm a care manager interested in helping people who want to apply this protocol. Can I join the course as a care manager? Absolutely, Beth. We would love to have you. Thank you. Yes, I'm sure. My hope is that you would be able to, yeah, again, it's that ripple effect. You're in the industry, so that having that ripple effect and turning people onto this would be so, so, so wonderful. We would absolutely love to have you. And I hope it adds value, for you, when you talk to people, you have this sort of area of expertise that many people don't know about. I was talking to a group kind of randomly, a woman in Kansas, who's very supportive of the work we're doing at the Clear Mind Center there. She's in real estate and she coaches a ton of real estate agents around the country who focus on senior living. And so she invited me to do a Zoom call like this for them. And all she wanted was for me to just like tell them about what we're doing, because so few people know about it. And just them having that edge, like knowing about this as a real estate agent, was like super valuable for them. I had never really, that hadn't dawned on me that that would be the application. But, however people learn about this, like I just want the word to get out. So thank you, Beth. Yes, yes, yes. You are more than welcome. We would love to have you. Oops. Okay. So from an anonymous attendee, does craniosacral therapy help with mild cognitive impairment or Alzheimer's or other levels of dementia? Yeah, great question. So what we've seen is that the same thing that helps with fully progressed dementia and Alzheimer's and mild cognitive impairment, you like the spectrum, it doesn't really matter where you are on the spectrum unless someone is so far progressed that they can't lie there, but you can't get them to do it. You can't, I was talking to a family this morning and their mom has a MoCA score of 3 out of 30. She has a single digit MoCA score. So this is a very progressed disease state. And we were talking about how she has sleep apnea, and sleep apnea is a causal factor when it comes to dementia. It's hypoxia. You're starving the brain of oxygen at night repeatedly, night after night. And they just didn't think at this stage, she's been combative, she's had hallucinations. And the thought of adding mouth tape or a mask, a CPAP, going through a sleep study, it just wasn't possible for her. They didn't think. So they're going to try after our conversation, but that becomes a lot of the issue as people progress through the Alzheimer's, the demise, right? Through the progression of the disease that's expected from the conventional perspective, is that it's hard to get people to engage, right? So, and that's part of that really challenging conversation about, is there a point when I give up, when I lose hope? If you can get people to do things, to make changes, then there's still hope. There's always hope, because I've watched miracles happen. I mean, I've just seen people who should not have gotten better from anyone's perspective get better. It blows my mind still. So I never say that there's not hope, but how do we apply these therapies? We want to be pragmatic, right? It has to be possible. And then also, what's our bandwidth? How many things can we do? And then also, what's going to give us the highest level of benefit, right? Treating sleep apnea, very high benefit. Having a bowel movement every day, very high benefit. Getting into ketosis, very high benefit. Getting some movement, very high benefit. For that particular person, is craniosacral going to be the maximum benefit without going through a cognoscopy, without going through an intake? It's hard for me to judge what's going to be the most beneficial. Now, if somebody's highly wired and they've had jaw issues their whole life and they've had traumatic brain injuries and they're super anxious and they tend to like hold a lot of tension in their body. Craniosacral might be a really impactful modality to add, but it's not the first thing I put on my list for most people, but something certainly to consider. For people that are on a Mediterranean diet, as they get digestive stress on ketosis, will adding C8 to coffee in the morning help if not in ketosis? So yeah, the C8, C10, adding coconut oil, adding MCT oil, but if you say digestive distress, I worry about diarrhea with adding coconut oil or with adding MCT oil. So just go slowly. But coffee plus oil, it can be disaster pants. So just be careful, go slow. So Karen, can you do BHRT if you've been in menopause for 10 years? Is it safe to start that late? Great question. It's something to discuss between you and your provider. I have done it. I feel comfortable doing it. The Finnish trial, the trial that was done in Finland, it was an epidemiological retrospective on 496,000 women. And they suggested that initiating progesterone and estrogen or estrogen alone in your 50s, 60s, or 70s. So starting either right around menopause, 10 years later or 20 years later, reduce the risk of dying from breast cancer in every decade of initiation. The most reduction in risk was if you started in your 50s. The next most reduction in risk was if you started in your 60s. And the third most reduction in risk was if you started in your 70s. But they all got reduction in risk. So that's one trial from Finland, white Western European women. So, I think that if you have dementia or you have cognitive decline, is it worth considering and discussing with your provider? Yes. Is it for everyone? No. And it's really a risk-benefit analysis that is individualized, and you want to discuss with your personal provider. Is there a dental probiotic that I really like? Zymogen used to have one. I don't think they make it anymore, but I did like theirs. I don't know of one off the top of my head, but I like coconut oil. I really like the oil pulling. Coconut oil has lauricidin in it, and lauricidin is mildly antimicrobial. And so that is a way to kind of keep the bad bugs down. And then I think just eating good, highly fermented foods with lots of good probiotics in them is a great way to do it too. From Paula, I can't wait to start next week. I'm so happy you're joining us. Yay. I just found out my mom has 9 root canals. Oh my gosh. Any suggestions? Yeah, a cone beam. So thank you. Kathy started this conversation around a biological dentist. And the biological dentist, one of the way they do the assessment is through a 3D X-ray or a cone beam. And I think that is the next step. If you need help finding a biological dentist in your area, email Tyler and we can chat about it on the call next week as well. We'll make sure that happens. Do I have a preferred way to address concussion injuries? Yes. So the concussions, if you want to catch them in the first 12 months after they've happened, that's when it's easiest to treat. But we do high dose fish oils, methyl B12, phosphatidylserine, phosphatidylcholine, and I'm going to type this out because I know that that's a lot and they're big words that nobody can spell. Methyl B12, high dose fish oils, like 10 grams a day of omegas. And if somebody's on blood thinners, be careful because that can be kind of blood thinning. And then phosphatidylserine, phosphatidylcholine, eggs have lots of choline. And then we do IV NAD plus if possible. And then hyperbarics or EWAT, exercising with oxygen therapy, some kind of oxygen therapy. So those are a few ideas. So try, if even if you can get in the next, within that 12-month window, we see much more benefit, much quicker benefit. The other thing to consider is a functional neurologist. These are chiropractors who are trained to identify where the deficits in the brain are, like on the map of the brain. And then they give you exercises that are very specific to rebuilding the neurons in that area. So after a traumatic brain injury, if there's been there's basically dead brain cells in there, if that's happening, then they'll help you to rewire. So it's an interesting approach, and I've seen it be very, very helpful, including like way later, including 20 years after a TBI or traumatic brain injury. Is there an easy way to find out if you need to supplement with iodine? So Carol, there is this iodine skin test because there aren't great blood tests for iodine. So naturopaths, I don't typically do this, but because you're asking, I'll tell you what some people do. And you just take the skin on the bottom of your arm where it tends to be lighter, put a drop of iodine and see how quickly it's absorbed. The way that I was trained to interpret this is that if it absorbs really quickly within a couple hours, less than 24 hours, you need more iodine. And so you can take oral doses. If it doesn't absorb very quickly, if it takes more than 24 hours, then you probably don't need that much iodine. So that's a way to test. Now, be careful with iodine because it can be detoxifying, particularly for the thyroid. So if there's these halogens, when you look at the periodic table, which many of us haven't looked at since high school, right? There are these halogens, which is fluoride, chlorine, bromine, and iodine. They're in that same category, and they can take the place of each other in your thyroid. If you add a ton of iodine, you'll kick out the chlorine and the fluoride and the bromine. And so you want to be careful with adding, like sometimes I see people taking 12.5 milligrams of iodine. Add minerals, make sure you're mineral replete. You have plenty of minerals on board. You're not low in sodium or potassium or magnesium or zinc or any of that. Plenty of minerals, and then add microgram doses of iodine if you need to supplement. So like 200 micrograms, maybe 400 micrograms. Don't get into the milligram doses without good support from a provider, because that can be too much quickly. In the thyroid world, there's experts who are like all about huge doses of iodine, and then there's experts who are like no iodine. And I think both are right. It's just how you do it, and it's for the right person. So iodine is not benign. It will, you can throw yourself into a thyroid storm, and you can do a lot of detox very quickly. So just be careful with it. And maybe have a naturopath or another provider support that process, or at least go slowly. From Stephen, are your costs, classes, or programs covered by Blue Shield of California medical coverage? I wish. The testing, a lot of the testing is. I was looking over the weekend on some testing, and I I was like, yay, we're getting some testing covered, which feels really good. And my hope, and Stephen, what we're trying to do here is make this more and more and more accessible. And yet we're at the tip of the spear of this movement. And so thank you for your patience with us as we go through that slow process of getting this more and more covered. But I know that what we're doing reduces the cost overall. And so insurance and any kind of risk management, and certainly the government, right, Medicare, hopefully we'll start to see that this is helpful. Can we offer treatment plans, protocols for folks on a budget? I feel like a yo-yo, you're on your own. And if your employer gets wind of your medical issue, you're fired. So Stephen, what I will tell you is that there's this great story of patient zero, Dr. Bredeson's patient zero. She was working at like the CIA or the FBI or something, and she was terrified that her employer would find out, and she was starting to lose her cognition. She was very aware of it. And she was scrubbing through the medical literature. And this was back, I think, in 2013 or 2011. It was a long time ago. And she, was absolutely terrified. There wasn't a book. There wasn't a provider. There was nobody out there doing what we're doing. And she found Dr. Bredeson's with like his initial paper, hunted him down, called him up, explained her scenario, and was like, what do I do? He was like, I only study mice. Like at this point, he didn't really know what to do, but she was like, just tell me what to do and I will do it. I will try. So fast forward, I like get chills telling the story. Fast forward, She's in the movie Memories for Life. She's called Patient Zero. Well, since then, she's like taken the mask off. She's become a Bredesen trained coach. She supports people who are struggling with dementia, and she's like made a second career. She retired from wherever she was with the three-letter acronym in the government, and she's made a career out of supporting people with dementia, having had it, like, who would have thought that you could get the resource of someone who used to have dementia or Alzheimer's as your coach taking you through this. So she didn't have a lot of resource because they didn't exist. And I can't tell you soon how many people have come into my office with Dr. Bredesen's book, dog-eared, and there's post-it notes and there's notes in the margin. And they're like, my mom's way better, or I'm way better. I just want to put the icing on the cake. I want to get even better. I want to make sure that it doesn't go down. I want to make sure I'm not missing anything. So you can take the $28 book or the $15 book. And in the book that we wrote, that Kate and I wrote, my collaborator, we outlined in the back like a dozen things more, I think, that you can do for free that cost nothing. So don't let cost get in your way. It's what we choose to eat. It's put in our mouths, how much movement we get, what time we go to sleep at night, how we prioritize our sleep, and how we manage our stressors. Those are the things that change the trajectory of our health over time and the health of our brain specifically. So yeah, if you have a budget, there are ways to work in it, but you will have to do more on your own. And I wish we could do all of this for free, and I wish that it were all covered, but I gotta pay Tyler and I gotta keep the lights on, and it's very labor intensive. And so yes, we want to help in every way that we can, and we hope we add a ton of value. And there's like the financial reality for all of us. And so I am working hard to make it more and more accessible. That's part of writing the book. How do you find doctors in your area that address this issue that are not a neurologist and will take away your driver's license? Every provider has the responsibility of alerting the DMV if they don't think it's safe for you to drive. But finding doctors in your area, what I would do is Google Bredesen trained provider near me and see what pops up. That's one way to do it. What protocol do I recommend for mold toxicity? I recommend Dr. Neil Nathan. And I'm going to show you his book because it's right behind me. He wrote this book called Toxic. And again, so Dr. Nathan and Dr. Bredesen have been my mentors. I'm so lucky to have been training with them for the past, Dr. Nathan even longer than Dr. Bredesen. And Dr. Nathan's book is another one where people come in with the book and they say like, this made me so much better, but it's time for me to do the testing, or I need the prescription. And so can you help me with that? And it's so great. Like the mold toxicity, I'll tell you, I don't recommend the shoemaker approach. I recommend Neil Nathan's approach. I have seen that work much better. People don't get sicker, they get better. It's less overwhelming. He's very compassionate in his approach, and many people with mold toxicity are highly sensitive. And so I think that's important. All right. If you have already been given 2 PET scans and have the highest level of plaque in your brain, do you feel it's a good idea to do the Leqembi trial plus doing the protocol to stop any more plaque? So unfortunately, I don't think that you're eligible for Leqembi, or maybe for a trial, because Leqembi right now is approved for the earlier stages. So potentially, yeah, if there's a lot of plaque, I would do it with the protocol, certainly, because if you get rid of the plaque, but you haven't gotten rid of the reason why there's plaque, then that's when I expect people to kind of come, maybe not get better, is if the plaques are there to be protective. So you need to remove what your brain is protecting you from. So hopefully that's helpful, but yeah, I don't know exactly I don't know the details of the Leqembi trial. So if there is one, yes, look into the trials. Thank you. Everybody who joins the trial helps all of us know. Oh, another Avanthia, sorry, dementia reversal trial. Yes, great. based on Dr. Bredeson's webcast, but I haven't heard from them. Do you know how they contact a candidate? I do not. I am not involved in the trial, so I do not, but there are phenomenal doctors who are. And so that's really exciting that you've signed up to be a potential candidate. Again, thank you, thank you, thank you, because we all learn from your experience and from the data. So thank you, thank you, thank you. That's huge. You're really doing a service. From Randall, are you offering payments in the course? Well, you are already in the club, Randall. But yes, we offer a payment plan for the course. So if it feels like a lot to bite off, then yes, we do offer a payment plan. Thanks for asking. Is galectin-3, is that helpful in determining Alzheimer's risk? Good question. So Donna, galectin-3, I'm familiar with it mostly because there's a gentleman named Isaac Elias who started a supplement. He's a doctor, he's an acupuncturist, he's a meditator, he's somebody I have a ton of respect for. And he developed a Pectisol product that removes galectin-3 and helps to mop that up. And it is one way to measure inflammation that can be associated with Alzheimer's, but also cancer and other chronic diseases. And there's this new TB006. It's this IV that's available through trials, basically, that sometimes helps people, apparently. I don't know that much about it. The research on it isn't very good yet. And so, but it is out there and available, and there have been some miracle stories of binding galectin-3 much, much, much safer than binding amyloid. Excuse me, I feel like I'm gonna sneeze. So if you want, excuse me, so sorry. If you want more information about that, Donna, you can reach out to us. Actually, Robert Lev, who was here last week, he's partnered with a gentleman named Josh Hellman, Dr. Josh Hellman, and Dr. Josh is offering the TB006, which is that galectin-3 antibody. What you would want to do is measure that before you entered that trial, but that is out there as an option. From Karen, is the Bredesen protocol available with a virtual provider where we could get blood work locally and be under the care of a doctor? Yes, that is absolutely available, depending on what state you live in. So whatever state you're in, you need a doctor who's licensed in your state. Dr. Dan LaPierre, he is in Colorado, outside of Boulder, in a town called Louisville, I think. And he is fantastic. He's so wonderful. And he looks like a movie star. He's just so fun and wonderful and happy, and he really good at what he does. He gets reversal of disease. He gets great results. And he is supporting our residents in Kansas, and he's an MD who was an emergency medicine doctor and has licensing in a lot of states. So yes, you can almost always find a virtual provider and get blood work locally. Yes, that's definitely an option. If you're in California, we're happy to support you. From Marie, I want to help my husband reverse his MCI, but he's in denial and resistant to change. Do I just give up trying to reverse the MCI and go with connection over correction and watch him decline? So Marie, this is such a great question. My suspicion is that if you lean into connection over correction, he will probably start to come with you. And especially if you are modeling exercise and diet and getting to bed on time and creating an environment where it's easy for him to do those things. I would love to have you in the course because I feel like we could talk about this for many, many weeks. But yes, absolutely. I think that you do not need to give up. I think yes to connection over correction, but I don't think that they are two different directions. I don't think that one leads to decline and the other leads to better, right? Like when you connect first, I think you'll be able to get him on board and he'll be able to do more, right? When there's more joy, he's going to want, it's going to be addictive. He's going to want to keep showing up for that. When he gets on the diet, he's going to feel better. When he's sleeping better, whatever it is for him. So, yeah, Marie, I think it's definitely worthwhile to connect over correct and also watch him improve. I think that that's definitely possible. You don't have to give up. From Dr. Sanpal, have treatments for sleep apnea changed? Many people have different difficulty using the CPAP and give up. Yeah, yes, we've had lots of people say that. And we've also been emphatic about how important it is to treat sleep apnea for people struggling with cognitive decline. And so we really, really push for them to use their CPAP. And then once they do, they say they can't live without it because they start sleeping so much better. So it's about being persistent. There's a friend of mine, her name is Audrey Wells, and she has a whole course on how to make friends with your CPAP. She's a sleep medicine doctor. But also there are dental devices, there's mouth tape that you can start with, there are APAPs, the alternating pressure machines, there's also the travel ones and like the pillow. There's a bunch of different ways to address, I mean, not a bunch, the CPAP is the gold standard, yes, but there are creative ways to do different things. There's positional pillows to keep people on their side where they're more likely to breathe through their nose. There's a lot of different strategies. And yeah, it's not one easy answer, but it is worth discussing and going through that process. Okay, Barbara has a question. Hopefully, Tyler, you're able to connect with her about that. All right, I'm going to take a couple more questions. And really quickly, I just want to, thank you, to just get organized really fast here. All right. Okay, so we'll take a couple more questions. Oh, comment on choline supplements and TMAO levels. I am not super familiar with that, and I don't really have a comment. You might know more about that than I do. I think of TMAO as being elevated in people with dysbiosis. So when I see high TMAO, I usually add gut support. Comment on the effects of pre and probiotics on cognition. What about inulin powder? That's a prebiotic. So it really depends on this person, right? Like we have to put it into the big picture. Would I expect pre and probiotics to help everybody with dementia? No, I would not. But if somebody with dementia has a lot of dysbiosis, they've got the wrong gut bugs, and I saw a lady today who's got Giardia, and she's got really low levels of the good guys and really high levels of the bad bugs. And so would I expect it to help her cognition? Potentially. But I wouldn't ever do it on its own, right? We need to change her diet, her sleep, her stress management, her exercise habits. We need to get her toxins out. We need to get rid of the infections. We couldn't just do that on its own. Mountain View, did you mean to use coconut oil like mouthwash or to cook with it or eat it as a tunnel probiotic? Yeah. So great question. So coconut oil, like a mouthwash, swished in your mouth for about 10 to 20 minutes, is called oil pulling. And you can just Google that. And there's lots of instructions and YouTube videos, and I'm sure TikTok videos of people doing oil pulling, and then you spit it out. It's really important to spit it out after you're doing that, because it's kind of detoxifying and you're getting all the bugs and stuff. So you want to spit it out. You can also cook with it. You can also eat it. Yes, there's lots of ways to put coconut oil to work. You can put it on your skin as lotion. Tons of ways to use coconut oil. We love it. So all of the above. When do you know if it's safe to take a person off their prescribed medication? My husband has been on memantine and doesn't appear to be helping. The doctors want me to let him have antipsychotic to help alleviate his aggression, and I'm not happy about it. I've been trying to use natural dietary methods instead. Is there anything that you can suggest that helps to calm? And what do you think of CBD oil? I'm so sorry. This is such a rough position. So I would not take him off memantine, because even if it's not helping, if he's been on it, coming off of it is it can be really stressful, and you're basically messing with the neurotransmitters when you add it and when you subtract it, and subtracting it can be really hard on someone and on their cognition, also on their mood. So I recommend keeping that memantine dose slow and steady. Just don't increase it. If it's not helping, don't increase it. If it's not helping, don't reduce it. Just keep it the same so that you have that variable stable. The antipsychotics are hard because we see that they are associated with an increase in all-cause mortality. Basically, they increase the risk of your loved one dying of all kinds of things. So I appreciate why you're trying to use the natural approaches, and yet, I mean, Seroquel does wonders, right? If somebody has behavioral issues, sometimes you're stuck. If someone especially is combative or violent or aggressive, as you mentioned, you're often stuck in a spot where you can't get help if you don't medicate. So again, this is one of those impossible decisions to make. And having a good team to help talk you through it, having family members, I can't express enough how helpful that can be. The dietary pieces, if you are in a position where you can try them, if you can try amino acids, work with the provider because he's on some medication. So you just want to make sure that you're not doubling up on too much, or you're not going to throw him into serotonin syndrome, or, without knowing his medication list, I don't feel comfortable kind of suggesting much there. But typically amino acids and protein, high protein diet, lots of potentially getting into ketosis could be somewhat helpful. And then CBD oil, I don't recommend THC because it's hard on cognition. But CBD, if some people use it topically and notice that their loved one is more calm. So there are different ways to do that. I don't use a ton of CBD oil, so I'm definitely not an expert in it, but I think it can be worth trying. Does olive oil help with cognition? So olive oil, really good, high quality olive oil can be part of a full approach, right? It's high in polyphenols. It's right. It's one of our good fats: olive oil, avocados, coconut oil, coconut milk, coconut cream, butter, ghee. This is in that category of these good, healthy fats. And so olive oil and honey, right? They're like, there's lots of counterfeit out there. So just be careful. I taste it, right? The really good olive oils, they have that peppery taste. And so get the good ones. That's something that's worth investing in my opinion. Stephen is waiting for my book to arrive. Thank you, Stephen. Happy Wiggle. Thanks for ordering my book. Makes me so grateful that, thank you. Whenever you guys join the course, whenever you buy a book, whenever you engage, when you make a comment, when you show up for one of these, it tells Tyler and I that what we're doing is valuable and that you want more of it. And so we are so, so, so grateful. So iPad 2 was saying, thank you so much for all of your seminars. You're so sincere, and I'm working hard at following the RECODE protocol. I wish there was more support in British Columbia. I feel like there's a good person in British Columbia. But hopefully, gosh, you can find them and connect with them. Yes, there is support in BC, and I don't know where you are in BC, but there's certainly support in Seattle. I don't know if you can make it down there, but there is. I'm just so grateful. There's hope. There's a lot going on in this space. Tyler and I are here to help, and we would love to see more of you all. Thank you, thank you, thank you. And Carol, hi, thank you for just your support of us. We're so grateful for everyone who joins, because we're like, this gives us purpose. This gives us meaning. You're allowing us to do our work in the world. So thank you, thank you, thank you for showing up. Thank you for being here. We are doing another webinar next Wednesday at the same time. Stay on the lookout for who our surprise guest is. We're so grateful to you all. Thank you, thank you, thank you. Be well.